Hi, I'm Margaret Muller Guide, physiotherapist, here to show you how to do a short arc quad exercise. An exercise that's often prescribed by your surgeon pre and post knee replacement, sometimes hip replacement, and certainly if you have knee pain when squatting, have found that you have either had some pain, discomfort, you know you have arthritis in your knees, this is an exercise to do, but important that you do it without pain. So the short arc of the quad means that you can make that arc as small as you need to. So if you did not see how to do the isometric exercise, then you want to refer and start there, which is where the arc is really just like 0 or 5 degrees. It's so little the motion in your knee. That's where you start. When you're ready to progress, this is where you're good to go. For this, back in 30 years ago when I started working in physiotherapy, the big coffee cans were really popular. Now the big protein powder plastic tubs are more popular. So that's what we tend to use and easier to get from family members. Covering it with a towel is really nice so it doesn't slide, especially if you're doing this on your sheets. The plastic on the sheets tends to slide away quite a bit, so just wrap it through a towel. It creates that friction that you need. And then a little support if you're doing this on the floor. If you're on a firm bed, having a little lumbar support is really good just to keep your spine in good position. If you'd like to use a pillow, feel free to do so. However, I encourage you to use as little a pillow as possible so that you can be working on your posture at the same time and your head and neck alignment. All right, coming down onto your side. So always on your shoulder before you roll over to keep your back protected. And you want to ensure that your support in your low back is right there in the low back. And you're going to want to ensure that your support for your knee is going to be resting just beneath the knee joint itself. Now in this exercise, the leg is going to stay in contact, or the back of the knee is going to stay in contact with the towel the entire time. It's not lifting off because that means you're using other muscles. The other knee stays bent. That's going to keep your back protected. That and the use of your abdominals when you're doing the exercise. So you want to keep a little tightness in your abdominals so that you're feeling that support the whole time in your back. Now as a bonus, you could turn your palms to the sky. Tuck your shoulders underneath you and keep your head in good alignment. You want to have your knee, cap, and your toes pointing to the sky. We'll take a breath in and exhale, pulling your toes towards you, tightening all the muscles in your upper thigh, and then slowly releasing. Now I've seen hundreds of clients just do this with so little effort involved. And when I've just tweaked how they do it, where they're actually using as many muscle fibers as they can, it's as though I've just thrown a 100-pound weight on their ankle. So it makes a difference being mindful of what you're doing, thinking that, okay, when I lift my leg, do I feel like I'm contracting all my muscles? Right now, I don't. But if you are mindful of it, you're going to really think about tightening as much of the muscles of your upper thigh. So taking your breath, pulling your toes towards you, squeezing, pressing your leg firmly down. And hopefully you can see how I'm recruiting so many more muscles. If you want to feel how the muscles can be recruited more, place one hand on your thigh, take your breath, pull your toes, and think about, just like you would your biceps, you're thinking tight, tight, tight. You're thinking of tightening all of these muscles in your upper thigh to recruit more of the muscle fibers. That way, you'll get the most out of your workout. You're going to build to doing a set of 10 repetitions, 2, 3, and back down. I'm going to do 2 more with you just so you know pretty much the sequence in which how to do it. Breath in, pull your toes and blow. 2, 3, slowly back down. The down part is part of the exercise. Actually, it's the hardest part. Breath and pressing the back of your knee into the support, feeling those muscles tighten, and then slowly returning it back down. Once you have reached a set of 10 comfortably, you should do the same thing on the other side. You don't want to have one strong leg. I often see that people who have not exercised for a long time and they feel, oh, that's my sore knee. And then I see them and they're like, oh, that's your strong knee. The other one's your weak one. It's only because you've strengthened one side. So be sure to always strengthen both sides. And then once you're comfortable with doing 2 and maybe even 3 sets of 10, know that you have a rest time between each set of 10, which doesn't mean it has to be totally rest. You could be doing another exercise, you could be doing some ankle pumps, you could roll over on your stomach and do a stretch, or you can be resting in your rest time. But once you have built up to doing 2 or 3 sets of 10 and it's starting to feel a little easy, challenge yourself by putting a half a pound or a pound of soft weight, like just an ankle weight that you can strap on, and do the exact same exercise with the weight. And that's your progression and how to do a short arc quad. All the best.